The primary care centre currently deals with more than 1,000 calls a day. The majority of them come in at 8 a.m. when the appointments become available, and this creates a massive bottleneck of calls. When you do eventually get through, all-day appointments are inevitably taken.
It is a problem. It hasn't been working. I've accepted that in Parliament. And what we're doing today is introducing a series of measures, all of which combined will hopefully resolve the problem. I don't believe it's a question of putting more appointments in or changing individual items. It's a complete package of measures which will deliver the resolution to the problem.
Unless we change attitudes and behaviours of the community, we'll just fill those appointments up. I think what we're saying as a GHA, we've kept our promise. You told us there's a problem. We're giving you these extra appointments, almost 500 a week. I think there's enough appointments now in the system that can respond to the needs of the local population. But it'll only happen if the local population listen to us and, as I said in the presentation, start looking at self-care, using community pharmacists, and not think the most important thing is to run to the GP to get an appointment.
The new system splits the phone service in two. Day appointments will be taken between 8:15 and 11 a.m. For advance appointments, bloods or other services, you can call in between 11 a.m. and 3 p.m.
If you want your bloods, if you want your repeat prescriptions, if you want to make an appointment for one of our clinics, you can do that between 11 and 3. And that way the traffic I'm trying to control, because if we continue as we are, even though I've put extra staff in there, even though we've offered more appointments, people won't be able to get through.
There will be more people on the phones, and appointments can now be made 4 weeks in advance. Online and app appointments can also be made, and you can even nominate your preferred doctor.
All of these things together will work together, but a key part of that is the app, no question, and also having the ability to do this easily online without having to be on the phone trying to get somebody to answer the phone, despite the fact that we have a lot more people now answering the phone, beside the fact that we've got the one-on-one triage service working with the PCC. So I think that it's those combination of things, as I said at the outset, that will resolve this issue and help us to provide a better service to the community.
There will no longer be an on-call doctor in the evenings, but there will be 24/7 access to the 111 hotline managed by doctors, nurses and paramedics.
It will be changing. I mean, if you look at the activity of the on-call service, yes, during the day we do some house visits. Very seldom used in the evening. So that means you have doctors on call who will tell you they're not called out. So with the 111 service, we will have a doctor based there at times, we have a paramedic, we have a nurse. So we still have the clinical services, but we don't need to have a doctor just sitting at home, I might be called out today. With the 111, this is really the backbone, I believe now, of the GHA. But at least no one in Gibraltar should feel now isolated, there's no one to help me. You have clinical experts available 7 days a week.
The GHA says the public needs to be responsible and work with the system to make it work. It therefore urges patients to request an appointment only if there's a real medical need and use community pharmacies as the first point of contact.